Mm. Oh, I'm not hearing nothing. Why? Because okay. Now I hear. I can hear all things. Yes, Miss Susan, I'm here.
Okay, camera. Yeah, my camera might be blocked. Turn camera off.
All right.
You can see my picture, but my
Yes,
camera.
yes,
I
yes, yes.
don't know where is my cam. Why is my camera not working?
All right.
Uh, so how is everything with you, Bogdan?
All is okay. I sent it one document, and I must to send another document. It will do. My brother is helping me from Italy,
Okay.
so he's going um, to the university and he's taking the documents. Especially they need the transcript, and
Okay.
the university sent it uh, in another mood. It was
Uh-huh.
another document. It's very similar, but it's not that they need.
Okay. So it's okay. Don't worry about that. That will take little time. It will take 2 to 3 months, right, to get all this paperwork and get the time to. When did you graduate from your bachelor's in nursing?
I graduate me from Italy, uh, and
When?
when in 2013.
2013. So it is 10 years.
Exactly.
Mm. So where did you work? You were working in a hospital before coming to United States?
No,
No?
for this, no. I decided to work with the truck and with the bus. So I worked as a bus
So you
driver.
didn't work in nursing at all?
Uh, exactly.
Why?
Why? Because the salary of the nurse in Italy is low.
Oh,
Especially it was low in that time. So I decided to earn the double, and I was happy for this reason. And now in the United States, I understand that the price, the salary of the uh, bus driver or of the truck driver is the same that is earning the nurse, and also the nurse can earn more because uh, working in this way, the person can be very tired. And
working in the truck is tiring? Truck
yes,
driver is tiring?
exactly. Yes, yes. Especially because the driver, wants to sleep. It's very dangerous. So after 8 or 12 hours, they must to sleep for
Okay.
sure. And the nurse can continue to work maybe a couple
So
of
how you
hours more.
came here to United States through family sponsorship?
Exactly. Yes.
Okay. Okay. Are you married?
No.
No, no married, no children, no marriage. So you have time to study,
Yes. Except
except you are doing extra job.
exactly. Yes.
Okay. So I remember before I went to India, I sent you some course material. I sent you some PowerPoints. Were
Yes.
you able to go through them?
Right now, yes, I can do it.
No, no, no. Were you able to go through those? I'm asking you. Did you do any of those questions? Did you practice them? Did you read them?
Yes, I read them.
Okay. So how did you find it?
Uh, it was difficult because there are a lot of details, especially the details about the values. Um, calcium, uh, potassium, um, uh, and a lot of values I must remember. I tried to do it, and uh, I remembered it only for a couple of days. So I understand that.
Because you never used it in your life. That's why. If you used it, if you were working in the hospital, then you will use it, you will remember what you were learning. The problem is because you have been out of touch, you have gone into the hospital only when you were student nurse, right?
Exactly.
Okay. So you were having clinical experience for everything. You did clinical for all medical, surgical, nursing, ICU, all the different rotations. Did you go to the hospital and learn with the patient?
Yes.
Okay.
Especially I was in the psychiatric department because I had my teacher with that worked there, and I was there.
Okay, so did you get chance? So which all rotations did you go? Which all specialties did you have clinical experience in?
Uh, with all, with all, I remember that I was more time in the psychiatric department because
But what are the other floors you went to? What other specialty floors did you go?
in the uh, floors of the oncology. I
Hmm.
remember this one. Go to the children um, um, department,
Pediatrics.
pediatrics, yes.
Hmm.
And but I remember better this one, the psychiatric um, floor.
Hmm. Okay, so looking at the questions, the type of questions I gave, it's not going to be very easy for you, I think, based on because you have had a gap for 10 years and you don't have any experience. So it's going to be very hard. But from your side, you have to work more like normally I take 2 months class for normal students, but I think you will take 4 6 months because you are not in touch with anything. You have to start from the
Yes,
beginning, right? So you
exactly.
have to study at least for 4 to 6 months for you to finish to be able to face the exam. So
I'm I'm ready.
other than the class I am taking, will you have like 6 to 8 hours every day to study?
6 to 10 hours every day,
Six
and
to eight at least. 6 hours at least every day can you study?
every day, no, but during the rest, during the days of in the nursing home, yes, I can do it.
Because uh, I don't know how far you will be successful because you have to start from fundamentals, everything. Like how you went for course, how many years it was? 4 years? 4 years course?
Of no, 3 years course.
3 years course.
Mhm.
3 years course, they say you're like any of your friends are they can do NCLEX and work as RN. Did you find out?
No, they are working in Italy.
Hmm.
So and also they are not interested to go to the United States.
Okay. Anyways, you are here and you want to do so. We might as well try, right? So
Exactly.
yeah. So, but don't think it's easy. It is very hard. It's very hard, especially for you. It's going to be more hard because you have language challenge also. Plus, you have a big gap. Okay. So we will start with. So I purchased the Archer for you. I tried to put your email address in that Archer, but it was not going through for some reason. So I will send you the password and the the link to open the Archer. You can do it, put it in your phone also, and then you practice whenever you get chance. You go into that. It will be good only for 2 months, only for 60 days. That's why I didn't buy. I thought the day we start the class, I will buy that day because you will get that many days more to use it.
Mhm.
And you have to try to keep on practicing the questions. Okay, so nothing is there to memorize. Memorizing is not needed. What we need to do is to understand what they are asking and to answer according to that. Okay,
Mhm.
there are some things you have to memorize, which is like numbers and stuff like that, but you have to do. Other than that, most of the thing is by critical thinking.
Mhm.
By critical thinking, you have to come to the answer. Okay.
Yes.
Okay. So right now you are working in the nursing home, right?
Yes. Yes. Yes.
Okay. So what kind of nursing home is that? Medical. What kind of patients?
There are different patients, but the most um, part of the patients are senior patients. So they are every time there. They are residents.
They are bedridden, like on the
Yes,
bed all the time, or they are walking around, or
maybe 60% of the patients uh, are on the bed. They are lying down all the day.
okay. So what are the activities you do with them? What are the things you are doing in your job? What do you do with them?
During the night, I'm changing the diapers. Uh,
Mm-hmm.
I'm helping to go to the toilet. I'm giving the food, sometimes the crackers. Also,
Mm-hmm.
I'm taking also the vitals. This is
Mm-hmm.
an activity
Mm-hmm.
uh, that takes a lot of time.
Mm-hmm.
And also, I'm taking the urinal. I'm cleaning the bed, um, and
Mm-hmm.
I'm changing them.
Okay. What about AccuCheck for blood sugar? Do you do blood sugar tests?
And no, I'm not
No.
doing it because we have the phlebotomist. He's doing it for the nurse, and
Okay. Okay. So um, I want to let me. How will I? I want to show you Archer. The lessons I sent you.
mhm.
You want me to do those first with you? Start with fundamentals, or like
Y- yes,
you
yes,
want me to
yes,
do that first?
yes. I prefer the fundamentals, so I will repeat all things, and when I will read the book, I will remember better uh, that I am reading, that I am studying.
Okay. So, okay, then let me just get the PowerPoint. I'll share with you. You can see it on your screen. And I will tell you a little bit about NCLEX and then I will go to the question answers. Okay.
Thank you.
Okay. I wish my camera was working. Unfortunately, I don't know what happened to the camera. It wasn't working last time. Something happened. Okay. Give me a moment, okay? Search. Can you see the PowerPoint?
For the moment, no.
No?
Uh,
No? Okay, 1 second. I have to go back to my Google Meet and then present now. Sure. Mm, in the caption. Can you see?
now, yes, I can see it.
Okay. So now, first I'm going to Did you read these? This I sent you already.
Yes.
Okay. So, what did you understand? Let me hear from you first. Then I will ask you, tell you remaining. What
Mm.
did you understand from this one, from this PowerPoint?
Uh, a geared up for NCLEX. Let's
Mm-hmm.
brush up. Do you want to study? Do you want to pass the NCLEX? You must study hard.
Okay. And
Uh, let's.
how is the how is the test plan? What is there in the test plan? Do you know that? No.
No.
Okay. So okay. So how so this NCLEX test plan, it has got these different category of questions. Okay.
Mm-hmm.
1, 2, 3, 4, 5, 6, 7, 8. These are the main categories of questions that they will bring. So management of care is 20% of the questions. Pharmaceutical, like pharmacological and therapies, all the medications is 15%. Physiological adaptation is 14%, and reduction of risk potential is 12%. Infection control practices is 12%. Basic care and comfort is 9%. And health promotion and maintenance is 9%. And physiological integrity is 9%. Okay.
Mm-hmm.
So this is the number of like management, the question. So which is the highest number of questions come from which area?
From management of care.
Yes. Why?
Because the nurse must to manage the CNAs and not only also the other co-workers.
Management of care, not management of staff, it's
Uh-huh.
management of care. So the nurse, the RN is manager of everything. She's a manager of the patient. She's a manager of, she should know everything about the disease. She should know she should be able to manage the staff. So she is a manager for all the other, everything that happens for the patient. She's in charge. She's accountable for. So that's why management of care has the highest number of questions. Okay,
Okay.
that is why we have this. So all those that you have to remember, that once you are becoming an RN, you are the manager of care. Okay, the format of the question is not in paper and pencil, it is actually computer adaptive, which means you open up the computer and then you read the question, you select the answer, and then once you click yes, then you go to the next question, like that. Okay, and this one, don't worry about the 6 hours, because this is the old format, not the new format. So how the computer adaptive test looks is, first, the lowest level questions are easy questions. If I'm going very fast, Bogdan, you have to tell me to slow down, okay?
Okay, I understand all things.
Okay. So there are three types of questions. Easy question is those which are like you just memorize, and if I ask you how much is normal potassium, then you tell me, okay, it is 3.5 to 5.3. That is easy question, okay?
Mhm.
And so these two type of questions, which means recall and recognition and understanding, these two are easy questions. And then application questions and analysis questions, these two questions are the difficult ones. In NCLEX, if you do well on these two category, then only you will pass. If you keep on doing this category, you will not pass. So how will the computer know how you are doing? So what happens is the computer will give you first question, which is easy one. It will give you little, like from little bit of little difficulty, not very easy, not very difficult. From here, okay, this level. If you do well in this question, this first question, then the next question will be more difficult.
Mhm.
If you do the next question and that also you do correctly, then the next question will be more difficult. If you do the first question wrong, the next question again you do wrong, then again you do wrong, then again you do. If you keep on doing wrong, the computer will give you easy questions. But the thing is, your answers, the passing line is here. So if you are doing the answer well, then next question will be hard. You did that correctly. The next question will be hard. Then you did that correctly. Next question. So then you are staying here above the pass line. If you are here, you are below the pass line. If you're here doing all correctly, each question will be more and more difficult, but you are above the pass line. If you are in this category, after some time, the question will shut off and then you will pass. Okay? But if you remain in this also, after some time, the question will shut off, but you will fail because you are able to answer only easy questions, not difficult questions. Okay? But if you are able to do some correct, some wrong, again it will be wrong, then you will do one correctly, then you do wrong, then you do correct, then you do wrong, then the computer doesn't know whether you are good or bad. You are a safe nurse or an unsafe nurse, the computer doesn't know. So it will take you through for the whole test, like 100 and whatever questions are there, like 5 big questions, and then some other questions, like 180 questions, something like that. It will take you. And then last question, if it is correct, then you pass. Otherwise, if it is wrong, you will fail. This is how the computer will check your knowledge. Is this clear to you?
Yes, yes.
If you understood this, okay. So this is how this is what a computer adaptive test means. Okay.
Mhm.
So this is about the previous NCLEX. So now, what is the advice for computer test takers? So you have to be psychologically prepared to feel like you're not going to pass, which means you should expect your exam to be difficult. If you feel your exam is easy, that means that you're getting easy questions. That means you're not doing well, right?
Yes.
If you're getting difficult questions, that means the computer is taking you to more and more difficult level, which means you are above the pass line, which means you should feel good. Oh, okay, I'm doing well. Okay.
Mhm.
So expect that. And then what you have to do is you have to expect that instead of like after 30 minutes you're getting tired, slowly you have to build up doing the questions over and over to be able to sit and work through without getting up for at least 3 to 4 hours. Because what if you are in the middle and the computer is letting you go till the end? If you don't build the stamina for it, then you're going to lose, isn't it?
Yes.
So slowly, slowly, like first you do 50 questions, then you do 75 questions in one sitting, then you do 100 questions in one sitting, then you do 125 in one sitting. Like this, you have to be able to sit and practice the whole length of the test. Then what else you have to do? As long as you are getting the questions, you can still pass. So don't think, oh my God, this is hard, I can't do it, this is too much. Because most of the people, they fail only when they think like that. Okay?
Mhm.
So as long as you're getting the questions, that means you're still in the game. There is chance for you to pass. So don't give up. And then don't look over your shoulders to others or don't look forward or back. Just focus at your test and try to concentrate on that. Okay? Also, know that NCLEX will always be very hard because difficulty level will keep getting harder and harder. All right? So, what you have to remember is read the question and answer carefully. Do not jump into conclusion or make wild guesses. So you have to learn to read the questions carefully. Okay?
Mhm.
And then don't jump into conclusions or make wild guesses. Look for keywords. Avoid answers with absolute, which I will tell you what always or never or all these kind of words. If there is, you should avoid those answers. And don't read too much into the question, but try to. We will practice this skill so you will understand what I mean. So we will teach how to eliminate the answers, how to clearly what is wrong and clearly what is right, what we will know and which one to remove, that we will learn. Because all these questions, there will be one answer, one question, there will be 4 to 6 answers. Okay. So there are different type of questions. Most of the questions are like that. Then there are other forms of questions which we will be talking about later. Okay. Watch for grammatical inconsistencies, verbs, and all that. That we will practice. Rephrase a question. So, in what you speak French at home? What do you speak? What language?
Italian,
Italian. So
Russian.
when you read the question, then you put in your head. You read the same thing in Italian and ask, okay, what is this question asking me? What you rephrase in the question in the way you understand, and then you put the question in your own words, and then you pluck out unnecessary information, and then you search for what is the core of the question, what is the stem, what exactly they are asking you. Because most of these questions, there'll be like one big paragraph is the whole question. So for that, you have to learn first to read fast, then to rephrase it, understand in your own words, and find out what is the stem of the question. And then even if you don't know the answer, don't make wild guesses, make educated guess, which means you try your best to eliminate what is not there, and then you think and then you answer. Then there is select all that apply questions. Select all that apply means for one question there can be more than one answer, or like out of one question, and out of that 5 or 6 options you will be choosing maybe 3, maybe 4, depending on what the answer is. Okay, so that is select all that apply question. The good thing about select all that apply questions in the new generation NCLEX is that even if you make, there are 3 questions in that you answered 4, but 2 of them are wrong and 2 of them are correct, you will get the marks for 2. Okay, it will not be totally 0 for that question. They will give partial credit. Okay, to
That's good.
understand?
Yes, yes.
Yeah, so you will get partial credit, so which is a good thing in the new gen NCLEX.
Mhm.
So each of those, in select all that apply, each of those options you have to think, okay, is it true statement, is it false statement? And then you should see the question is asking you for true or statements or false statements. So if they are asking for false statements, the ones which you mark false are your answers. Okay. So do not bunch or group your choices. Treat each choice. This also be when you practice, you will come to know. So I will skip this. Don't overthink, because sometimes you overthink, then you can make mistakes. Okay, right. So if you didn't pass, this is so you have not taken NCLEX exam at all, right? Even once?
No.
No. In Italy, do you have any kind of exam before starting working as an
Yes, yes, it was the general exam that contains the care in the chirurgy, the care in the pediatry, um, maybe five exams in one exam, five fields together.
oh, okay. Okay. So how do you study? How do you study is you should know what you know and what you don't know. Okay.
Mhm.
This, and they're saying study every day for at least 2 hours, but I am saying for you at least 6 hours you have to study every day. Otherwise, it's going to be really hard.
Mhm.
Okay, and you have to have a strong knowledge or all the content that is basically required. Give yourself quiz every day, 20 to items to 30 to 50, slowly, as I told you, you build up your
Mhm.
testing. And once you start getting 80% on your self test, then you are ready. More than 80, if you get minimum 80% to the software I bought for you,
Mhm.
that one will help you to understand, like, how are you ready or not. If you get green light on that, then you are ready to go. Okay, so all type of questions we practice, and then once you are ready, getting more than 80%, then don't wait, then just go and take the exam. Okay, so how do you do the elimination? First is you have to identify the topic of the question. Okay,
Mhm.
then you have to identify whether these are assessments or implementation. You know the difference between assessment and implementation?
Assessment is the validation, and implementation is the problems uh, of the assessment.
Okay, so assessment is you're gathering all the data,
Mhm.
okay, which you say validation. Yes, it is gathering data. What is data? What is the data as nurses? What data we can get from the patient?
Blood pressure, temperature,
Yes, yes, blood pressure, temperature.
the values of the blood,
Yeah, values of the blood
blood
tests.
test,
Yes,
urinal test,
urine test, all
sub.
the different tests, all the diagnostic tests. That's assessment. And what else? What about whatever we gather from all our five senses, like seeing, when you see a patient, the signs and symptoms, the patient is having severe chest pain, then how the patient looks.
Uh, uh,
The
uh,
patient is holding the chest, the patient is crying. So you're seeing, right?
yes,
When you're seeing those things, those are also assessments, right?
yes, redness.
Yeah. Then assessment, which means inspection. Then if you're hearing to the chest, suppose the patient is having tachycardia, you're hearing. So auscultation, you learned this in school, right?
Yes, yes.
Inspection, auscultation, percussion. You remember percussion?
Pain assessment.
No, percussion. What is
Percussion.
percussion?
Yes, this is touching the organs with the fingers.
That
Palpation.
is palpation.
Mhm.
Palpation. Percussion means you tap. You put your finger and then you tap like that. No,
Yes.
this is percussion. So inspection, auscultation, palpation, percussion. All this will give you assessment findings. The
Mhm.
patient is warm to touch. If you put your hand, you know if he's having fever, that the way it's warm to touch, right?
Yes.
So these are all assessment findings. And implementation is what you are going to do to prevent that, to address this assessment findings. Okay.
Mhm.
So, like if the patient is having fever, your assessment finding is temperature is
Temperature.
high, the patient is warm to touch. Your implementation is you want to give hydrotherapy, which means you will take a take a cloth and put cold compress on the forehead. You will remove all the blankets. You will open the window or whatever. and then you will give medication to prevent, like to give Tylenol or something.
Yes.
This is all your implementation. So things that you're doing to solve your assessment finding, your problem. Your problem is fever. Your assessment finding was temperature was high and the patient was warm to touch. Okay.
Mm-hmm.
And your implementation is all that you did. So implementations are the actions you are going to do.
Actions.
Okay.
Mm-hmm.
Okay.
Okay.
And then Maslow. You remember what is Maslow's hierarchy of needs? Do you
Uh,
remember that?
the first one is the food. The other one is the protection. Uh,
Yes, there is a Maslow's hierarchy of needs, which is like,
pyramid.
yeah. There, let me, if I can see Google and see if I can find a picture. It'll be good. So let me check. Okay, Maslow.
I have also the book here. Yes, thank
Okay, you have it in front of you, or no?
you. No,
No. 1 second. So let me go back to.
I can take it. I have the book.
Okay, can you see this?
Yes.
Maslow's hierarchy, you can see
Yes.
here on the side, small one.
Mm-hmm. Yes, I see it.
Okay, so the first is physiological, which is food, shelter, and clothing,
Safety.
right?
Yes.
Then next one is safety.
Mm-hmm.
You have to have a house. You have to keep the patient safe. Patient should not fall. This is for everyone, not just for patients, for all of us, all human beings, right?
Yes.
Then we have belonging and love. Then we have self-esteem. Then we have cognitive, aesthetic, all this. Okay, so this is your Maslow's hierarchy of needs. So if you don't, so how we are now we are learning in this. Send where it's gone again. Share the window. Oh, where did my PowerPoint got lost? Window. Okay, can you see now?
Yes.
Yeah. So Maslow's hierarchy is going to tell you. So if you have, like, what we are learning from this is how to remove the, like, if we have four answers, how do we come to the right answer? Okay. First is we have to find out what's the topic of the question. Next is we have to find out are the answers assessment or implementation. Always assessment is before the implementation. So if it is asking for assessment, those will be the first answers. If you then don't eliminate with this, then you use this Maslow's hierarchy of needs to figure out which is the physical and psychosocial. Always physical symptoms will take priority. Psychosocial symptoms will take later. Okay.
Later.
Physical symptoms are always the priority. And the next one is if it is related to ABC. ABC means airway, breathing, and circulation. Always anything to do with airway, breathing, and circulation, those are priority. For example, if a person is with having breathing difficulty, he's drowning, that patient, like he has pulmonary edema, he's just cannot breathe. That patient, you have to go and see first versus another patient who's ready for discharge, right?
Yes.
So airway, breathing, and circulation. Airway is the first priority. So consider that. And then you have to consider what is the outcome for each of the remaining answers. And then ask yourself, if you can do one thing, what you would do to save this patient. That will be your answer. Okay.
Mm-hmm.
So as we practice, you will come to know what I mean by this. Common traps in athletics: don't ask the patient why. Always say, okay, I understand you are feeling angry. You cannot say, why are you angry? You can say, I see that you are upset. Can you tell me more? Okay.
Mm-hmm.
You don't ask the patient why you can't do this, or you don't. Don't leave the client. Meaning, if you are having any problem is going on, you don't leave the patient and run away. You stay with the patient and you ask for help. If your patient is going to code, okay, code blue,
Mm-hmm.
you don't leave the patient. Oh my God, my patient is dying. Don't run here and there. Instead of that, you stay with the patient. You start with CPR. You do the basic life support, but you call for help. You should not be leaving the patient and going. Do not persuade the client. Do not persuade means don't force. I have to give you bath now, so I will give you bath. Not like that. In NCLEX, you cannot force any client. That is wrong. Okay, so don't force. Don't say don't worry, because there is something to worry for the patient. So you cannot say, okay, it's fine, don't worry. Instead of that, you say, I understand. I know how hard it can be for you, and then you say you want to talk more about it. So you ask open-ended questions. Do not pass the buck, meaning the problem don't finish. Don't like if there is any problem, don't move and send it for the next shift people to solve. If you have to solve the problem. Means like if, for example, a patient is very angry and he's shouting at everyone and he wants to break everything. So instead of you try to solve the problem, instead of just not dealing with the problem and just calling supervisor to deal with the problem. So in NCLEX, they are saying that you should not pass on the but you try your best to solve the problem, and then you follow the chain of command. Okay.
Mm-hmm.
Am I going too fast?
Okay, you're going very good.
You're okay. You're
Yes,
okay.
yes, yes,
You understanding what I'm saying?
yes, yes, yes.
Okay. Then do not read into the question. Means what they're asking you. See, don't imagine things that are not written and don't try to answer the question. Okay.
Mm-hmm.
And then do not do nothing, which means if there's a problem, the question is showing you a problem. Don't choose answers which says, okay, I will like trying to brush away and not do anything about the problem. Those will not be your answers. Okay. These are common clues for you to answer your questions. And therapeutic communication is very good, very, very important in nursing. How you talk to your patient. So there are some do's and some don'ts. Don'ts means what you should never do, and do's
Mm-hmm.
are what you should do. So what you should do respond to feeling tone. Means you should empathize with the patient, be feeling with the patient. So if the patient is upset, I saying, I understand how you feel, or you saying the family, I know how hard this must be for you because your loved one is admitted to the hospital. So showing a feeling tone, showing like as if you care, right? You have to do that. Provide information. So if they are asking you, if the family or the patient is asking you, for what time will I go for the cardiac cath today? So if you know, you provide the information. If you don't know, then you say, I don't have that information right now, but I will find out and I will let you know. Okay.
Mm-hmm.
And then focus on the client. So you, like for example, you want to give medicine and the patient is refusing, and you tell, I don't have time, you better take the medicine now, I have so many other patients to take care of. You cannot tell like that with the patient, because it is not about you, it is about the client. So you have to try to convince in a better way for the client to take medication, but you cannot say, I am busy, so you have to take. So the focus should be on the client and not on you. Okay.
Yes.
Next is use silence. Using the patient's child passed away, or the patient's child failed in an exam and the patient is really upset, then you just stay with the patient. Use your silence as a part of therapeutic communication. And then do use your presence. Your presence means, I'm here for you, I will take care of you, I will do this for you. So you use that. Don't ever ask why are you doing this. Okay, don't say that. Don't say, do you want this, yes or no. Mostly for all the psychosocial questions, you ask, can you tell me more. Don't ask only yes or no questions. Do not focus on the nurse. I explained already about that. Do not explore, and say don't do not say don't worry. Do not explore means especially if like if the patient doesn't want to say something, or it is if the patient is having psychiatric like you know like paranoid delusions or something. Delusions you normally don't want to explore. All right.
Mhm.
Then, as a manager of care, the RN also has to do delegation. Delegation means what? What do you understand by delegation?
Uh, Delegation is when, for example, I'm saying for my brother to do that thing that I can
Yes,
do.
yes. Delegate means assigning somebody else to do what you're supposed to do. So normally, because the RN is the manager of care, she is the one who delegates assignments to those who
To
are working under her. Okay?
CNAs, yes, for example,
Yeah, CNAs.
LPN.
So RN can assign the CNA to check, or LPN to check on assigned stable clients with expected outcome, which means normal patients. Patients who have same problem, like like your nursing home patients, nothing new is happening to them, right?
Yes.
So if at all something new is happening to one of them, fell down from the bed, then something new happened. At that time, the nurse has to take over. The RN has to take over. Till then, the LPN or the UAP CNA is okay to take care. But after this happens, unstable patient or unexpected outcome happen, then RN has to take care of the patient. She cannot delegate the care of unstable patients to these two. She is responsible for assessment. So any change happens, then the assessment is hers. Stable patients' vital signs is okay by these two. UAP means unlicensed assistive personnel, which is like you, CNS. Okay? Because you don't have a license yet as a RN or LPN. But LPNs have license. That's why they have put different category here. Okay?
Mhm.
So CNAs cannot for so assessment. The first assessment, which is admission assessment, is done by the RN. Teaching to be done by RN. All nursing judgment related questions, related assignments, everything should be done by the RN. The LPN, she can assign for stable clients with expected outcomes, and for UAP, she can assign delegate standard unchanging procedures, like unchanging, like vital signs, emptying the urine, emptying the drainage bag, then
Colostomy.
checking. Yeah, some hospitals they will do checking the check. All these things is done by even doing EKG. Sometimes they will teach because nothing changes in that procedure. Okay, these are all it can be done by this, but teaching first admission assessment, or anytime there's an unstable problem going on with the patient, that is all RN's job. You cannot delegate it to the others. Okay. So 5 rights of delegation is right task, which means within the scope of practice it should be. UAP and LPN, they have a scope of practice. RN has a different scope of practice. So whatever is within their scope of practice, only those things should be given to them. For example, if a patient is after operation is unstably walking, that patient cannot be given to a UAP or an LPN. That patient's moving should be given to the physical therapy or OT. Okay, their scope of practice it is. Workload should be given depending on the right circumstances. If the person says, if the UAP or the licensed person says, I'm sorry, I don't know how to do this, then it is the duty of the nurse, RN, to show them how to do it and make sure that they get a return demonstration. Like, for example, your RN is telling you to go and empty a wound drainage bag. Then you tell, I don't know because I have never done this before. And she will say, no, 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 you can do it. It's very easy. You have the right to say no. What she's supposed to do is come and show you how to do it, and then ask you to return demonstrate and show her how you are doing it, correct you if there is any mistake, then she can assign that to you, not otherwise. Okay. So right person, how user who's the right person? depending on the scope of practice, you choose the right person to delegate. Right communication, which means, like for example, as I told you, she's asking you to change the drainage bag. She should tell you specifically what task is to be performed, what time it's supposed to be performed, what is expected from that, and you follow up also. Okay, did you do that? Did you encounter any problems? So that right communication and right supervision. So clear directions and then intervene if necessary. So direction should be clear, and if you're making any mistake, then your RN should be able to
So,
correct those mistakes. So this is the 5 rights of delegation. So next thing what you have to remember is you are in charge of passing your NCLEX. Only you are in charge. I can teach you as much as you want, but unless you study, you will not pass. So I am only helping you. I am like a facilitator for you, but the work, the studying is you are going to do it, and only you can do it. So you have to take ownership of this, and you have to do it. Okay.
yes.
All right. So this was about the. This is all. This is the last. This is, yeah. Any doubts with this one?
No, no questions.
No questions. Okay. Let's go to the next. Stop sharing this. And let's go to the next PowerPoint I sent you. I sent you this one. This is for you to memorize. This is for last minute, like quickly to look up. These are like different kinds of things all together. As and when needed, you keep this print and keep this paper with you, and then you can use it as and when required. Okay. Oh, I'm not sharing it. You probably didn't see it. Hold on. Select a tab window. There is a share. Can you see now?
Yes.
So this paper, this one, is just the lab values, and then the Maslow's hierarchy of needs is here. So basically, what all main things that will come in NCLEX, everything is put together for a quick cheat sheet, like for a quick. So just print this and keep it with you. Okay. Then the other thing I sent you is like main drugs in NCLEX. So normally these drugs, which ones at the end, these 2 papers are for you at the end of, once you finish studying everything, just to look through as cheat sheet. Okay. These 2 things. Okay. Then so this was the first PowerPoint I sent you. Next one, which one I sent you was,
it was about the endocrine system.
okay, so
Digestive system.
Let me close this one. Are you able to see my screen?
Yes,
Sent.
yes.
Yeah, okay. Sent to opt-in. Okay, so the next one I sent was let's start with respiratory system. Okay.
Yes.
Oh, before that, I want to show you about that. Let me show you about the Archer. So I told you this is, so I will be doing PowerPoint from one side, and you will be doing this one. I also have access to this. You also have access to the same. Okay. So the email ID for this one is my email. I tried to put your email, but it was not going through. So you write down my email. This one. Can you see my screen?
Yes, yes, yes.
Okay. SUSANEDAMALA @gmail.com. Write down this. This is your
Yes, this is my email. Correct, my email.
Yeah, but this is correct. But I don't know, when I was trying to buy the product, I was not able to get this. It was not taking this email for some reason. I don't know why. So, so I put my email,
Okay.
and the password is success 2024. Success, SUCCESS.
Hmm.
That, I think I took a screenshot also. I- Yeah, I will share this with you. Mm. Okay, did you get it in your phone? Check.
Yes, I received your email. I have it. Ah,
Not
now the
email. My
message.
On the
Yes,
phone.
yes, yes, yes.
You got it right. You. So what you do is, normally just go. You can. I hope you can see